welcome back. I'm glad to be back here again, and hopefully in the new year now, I won't lose my voice again. I lost my voice for about a week over Christmas, and it wasn't very fun. My last live a few days ago actually still had a bit of a raspy voice, and anyways, here we are. And then I went and did a TikTok live right after that, and I almost completely lost my voice again. So I'm gonna give this another go, and hopefully my voice hangs in there. So welcome. If you haven't been on one of my lives before, my name is Paige. I'm a nurse. I've been a nurse for 32 years and mostly in critical care. And I worked in emergency rooms, in trauma, ICU. I flew with air ambulance. I've worked a little bit in the operating room and recovery room. I worked in mental health for a few years, in addictions. I worked in an inner city detox unit, and now I'm patient advocate. So that's what I do now. I help people navigate the healthcare system, and if you've seen my videos, you will know the things that I'm really passionate about. So there's a few things that I kind of want to talk about today. And also, when you're joining on here, if you have questions, this is a Q&A. I also have some topics. There's always lots of stuff that I can talk about. I'll just kind of wing it. But I really want to hear from you. I want to hear your questions. I want to hear if you feel comfortable sharing your experiences. Sometimes we've had, well, actually most of the time on the lives, there's people that share their experiences, and then usually there's someone else on here as well that has also gone through something similar, and then they kind of chime in, and it's really cool to watch, you know, people say, well, that happened to me too, and have you tried this, and have you tried that, and they share resources, and it's actually quite cool to see. So anyways, I'm glad that you're here, and if you know anyone that would benefit from this, make sure you go ahead and just bring them into this, share. There's a little arrow button at the bottom, and go ahead and share it. And if for some reason I miss your comments or I miss your questions or whatever, then just let me know that I missed it, and I'll go back and try and catch it. And respond to it. And if I don't know the answer, you guys, I'll just tell you I don't know, or I might go and find out. I have a lot of colleagues that are nurses and doctors, and so I can just reach out to them and ask them as well. So anyways, I'm glad that you're here. There's a few things that have really been coming up a lot lately, and one of them is medical biases. So all of the different kinds of biases that happen in the healthcare system. Oh, hey, Frog, good to see you on here. So there's lots of different biases, and as we all know, so age is a big one, and it's not just seniors that get a bias held against them, or they get judged, or a prejudice. It's not like people, I've often seen it more often is in seniors, and the doctor will say, well, it's because of your age. Hi, John. It's because of your age, or you're just getting older, and that's to be expected. And then they end up totally missing or not investigating the medical their symptoms that they're having, right? And they just say, well, it's just because you're getting older, and they just dismiss it and don't investigate it. Hey, John, so we're talking about, so I'm a nurse. I've been a nurse for 32 years. I worked in critical care emergency rooms. I worked in trauma ICU, flew with air ambulance. Now I'm a patient advocate, so I help people navigate the healthcare system. And so that's kind of what all of my my videos are all about. If you've seen any of my videos on here, they're just shorts. Most of them are just shorts about all the ways that people can fall through the cracks in our healthcare system. And there are so many ways. Our healthcare system is very broken right now. And I'm not on here trying to create fear, or I'm not on here there's a lot of that, James, for sure. Like a lot of it, it's a business, right? It is a total business. So anyways, my heart is to just help people. I'm not on here to trash doctors or the healthcare system. I've seen a lot of things that can happen. I've seen stuff. And so I just want to raise awareness for people, empower them, so that when they're navigating the healthcare system, for themselves or for a loved one, they can kind of keep these things in the back of their mind and kind of prepare for things, be a bit proactive. And so, yeah, if you haven't seen my videos, there's lots of them on there. I usually try and post 2 or 3 a day. But that's sort of where my heart is. And so I started, there was some requests. Oh, thanks. Yeah, your doctors have changed your life, Janice. That's awesome. And you know what? There are a lot of amazing doctors out there. I know a lot of them. I've been a nurse for a long time, and there's a lot of really amazing doctors. They're not all the same, right? Unfortunately. And so if you get a good one, keep them. And then, you know, I guess that's with any vocation, any job, any profession. There's going to be good and not so good. The problem is, in my opinion, in healthcare, people are vulnerable. People are at their, like, they're sick, they're scared, they're in pain, they're not feeling well, they're anxious, they're worried, all of those things. There isn't room for the biases that I've seen. And so yeah, I just don't think it's just really it's just really frustrating. For sure. Thanks, Janice. Yeah, so I'm really glad that you have a good doctor. That is awesome. Keep them. And I wish they were just all the same, but unfortunately they're not. And I've seen some horrific things where people fall through the cracks and all kinds of things can happen. So so this live is really to, if you have questions about things, and I can say if I don't know, or I can find out and get back to you for any kind of questions. If you want to share any of your experiences in the healthcare system, then go ahead and do that. Put it in the comments. And if I miss your comment, and it has to do with, I'll do my best to moderate. I don't have a moderator on here yet. I haven't done quite enough YouTube lives. I've done a lot of TikTok ones, so I've got some moderators, but I do my best to try and sort of take care of them, because I think if people are come on here and talk about stuff that is either rude or gross or totally not related, it's distracting, right? And I want this to be a culture. I want it to be a place where people can hopefully be heard of some of the experiences that they've had. So in the research field, they're almost all morally corrupt. They can be, for sure, James. I mean, I think it's like straight across the board in healthcare. There's a lot of moral, ethical stuff going on that is questionable. So Janice, you take your husband with me. Everyone should bring someone with them. 1,000%. Yeah, 1,000%, because, I don't know if you've seen my videos, but it's one of the things I'm really passionate about, is bringing someone with you, whether it's to the hospital, to a medical appointment, always. And it doesn't have to be like a professional advocate like me. It doesn't have to be a nurse. It doesn't have to be a medical person. It can be anybody who has your back, really. So anyone that has your best interest at heart. And there's a lot of reasons for that. Find an amazing primary, for sure, Janice. But having someone there, they can be an extra set of eyes and ears. They can hear the stuff that the doctor says. And I'll tell you that, and this has happened hundreds of times, where I go to an appointment with a patient, and as soon as there's a third party involved, the dynamic changes, completely changes. And part of it, I think, is because then the doctor knows, like, there's an accountability piece. So the doctor knows that they're being not watched, but there's someone else there to witness. The third party can also take notes for you, can help you ask questions if you forget. Because sometimes people, I don't know if this has happened to any of you, but when you go, you like this white coat syndrome thing. It happens because it's an authority kind of position. It's a power dynamic, and you can kind of forget the things. Like, I have left doctor's appointments and said, "Oh, I forgot to ask that." So the third party, the person that comes with you, can help you with that. They can also, if you have had situations where you're being dismissed by your doctor, and there's lots of ways that can happen, whether they don't believe your symptoms, they tell you you're too young or you're too old, they tell you it's in your head, it's anxiety, they don't believe your pain, like your physical pain that you're having. Although there's a lot of different ways that the doctor can dismiss. So if you have that happening, that third person that you bring in, they can kind of have your back, like they can validate what's going on for you. So yes, Susie Q can't work right now, or she couldn't work because her pain is so bad, or so-and-so can't sleep at night because their pain is so bad, like things like that, right? So absolutely bring a third party, have them take notes. And there's something else that happens when you bring out a pad of paper and a pen. And I just had somebody on my last live actually say, because I did a video about that, like the power of just having a pad of, not your phone. It doesn't work the same with the phone because we're desensitized to seeing people on their phones. Like, it doesn't really mean much, but bringing out a pad of paper and a pen, like you're about to start writing and recording, it changes things. And this guy told me that, the doctor was dismissing him, wasn't really listening. And then he reached into his bag. He even had somebody with him, reached into his bag, brought out a pad of paper, set it on his lap, had a pen ready. And the doctor instantly started ordering the tests he was asking for, ordered the referral, was listening, was documenting, was engaging, was listening to their symptoms and their experience. And so he and then he messaged me, and yeah, it was pretty cool actually. It's like that, it does work, and I don't know how or why, but it somehow does. So anyways, okay, I'm just gonna scroll here. I don't want to miss. They can reiterate what's going on for sure, Janice. And never stay with a doctor who doesn't listen. You have a choice. You do. Oh, hi, Melbourne. Oh, you're from melting Australia. Is it super hot there? Oh my goodness. I'm glad that you're here. Where I live, it's pretty warm too, but there's definitely parts of North America that have a lot of snow right now. So a lot of snow. Anyways, about getting a new doctor if your doctor isn't listening to you. Absolutely, Janice. Like, I believe that 100%. It's not, and I know sometimes I say it kind of flippantly, like, get a second opinion, get another doctor, because I know it's not that easy. There is a massive doctor shortage right now. So I get, like, it's not as easy as I make it sound, but they are out there and they can be found. It might take a little bit of work. There's also nurse practitioners, there's telehealth options. So there are some different options. Yeah, so I agree with that. But I also know it's not as easy as it used to be. You can't just go stand on a corner and say like, oh, I want to order a new doctor. So Melbourne, 41 degrees, 44 on Friday. That's Celsius. Oh my goodness. Oh, Janice, you're in New Mexico. Oh yeah, that would be warm. So 44 in Fahrenheit. I can't do the math that fast in my head, so I'm not sure how hot that is Fahrenheit. I'm on Celsius as well. Swan Song, hi. I have a severe fear of doctors, so your health issues pile up until it becomes an emergency. Absolutely, and that, thank you for sharing that. I know that is hard, and I was kind of just starting to talk about some of the biases. Now, I don't know what your experiences have been, and you're welcome to share them on here if you feel comfortable, but there's a lot of different reasons why people can get this fear. There's a trauma response. People are getting PTSD from the medical system because they're not getting the care they need. They're being dismissed. There's biases, judgments, not being taken seriously. They're not being listened to, all of the things I kind of talked about. And so I'm really sorry that that's happening, Swan Song. And you're right, it's this fear, and then you don't know who to trust. You are nervous to go kind of proactively, like if you notice something is starting, because you know your body better than anyone. Like we do. We have an intuition. We just know ourselves. And so when something's wrong. And and it makes it really hard to be proactive with your health when you're scared and you don't trust and you've been gaslit maybe. Maybe you've been not believed. Maybe you've been told it's all in your head, or it's anxiety, or all of those kind of things. So I'm sorry that happens. I would encourage you, I don't know if you have a family doctor. I don't know if you have a family doctor or not, but you can go just speak it directly to them. And I know it's scary. Bring someone with you for sure if you do that, but you can say things like, and again, I don't know your exact situation of why you have this fear, but I'm just kind of throwing some things out there that I've seen. But say, for example, your doctor is not believing that you have pain. That's a common one that happens, especially with younger people. And well, it can happen with all ages actually. But you can say to them, like, I understand that you don't think I actually have this pain. Like, I understand that. And you can kind of validate it. And it might be nauseating and hard to do that. But you can say that. I understand that that's what you think. But this is a real concern for me. Like, I'm afraid that something is wrong. And what things can we do to investigate it? Or what if it is something else besides you me making it up? And I would like to, what things can we do? Kind of put it back on them. What things can we do to investigate? Because I'm concerned about this. And if they still refuse, ask them. And I have a couple videos about this, and I use this line a lot, and I've used it in person, saying, okay, well, could you please document that you're not believing my symptoms and that you're refusing to do any investigative tests or any testing or whatever. You can and ask them to document. Then sometimes just asking them that, not that, I don't know that they would actually go and write that down. They might, I would doubt it, but it makes them pause long enough to sometimes reconsider or like realize like, oh yeah, I'm not being very, I'm not being very compassionate or whatever. I'm not listening to my patient. Anyway, I don't know if that helps, but let me just scroll here. And you guys, if there's comments, like if there's people on here that are commenting that have nothing to do with healthcare, I will probably not acknowledge them. But yeah, and let me just see here. I just want to see if she responded again. No, okay. If you guys may put a comment, a question, or want to share an experience and I happen to miss it, please just put it in again. Say, hey, dude, you missed my thing. And I'm just going to say quick too, if you are just joining on here, my name is Paige. I'm a nurse. I've been a nurse for 32 years, a long time. I've worked in mostly critical care, so emergency rooms, trauma ICU. I flew with air ambulance, and now I'm a patient advocate. So I help people navigate the healthcare system. So, and that's what we're talking about on here. It is a Q&A. I've also got topics we can talk about. So, but I want to hear from you. I want to hear your questions and your experiences. So, Diane, hey, I'm glad you made it on here. Can a doctor you ask for a second opinion punish you by forcing you to sign a leaving against medical advice and then threaten with an NSF or thrown out into a very cold night with no money? Oh my goodness, that sounds horrific. So I'm guessing, I'm just kind of filling in the blank. So you were in the hospital, you weren't getting proper treatment from your doctor, and they refused and kind of kicked you out. That's what I'm kind of guessing. And they made you sign an AMA against medical advice. Oh, can they do that? Technically, no. That's not right. Yeah, that's not right. I mean, do they do it? Yes. It's two things. So it depends on the size of your hospital. So some of the smaller hospitals don't actually have a second doctor right there for second opinions in the emergency room, or an extra hospitalist. But most like bigger hospitals, there will be somebody there, but there's ego, right? A lot of the medical profession has ego. And if they get questioned, then they don't like that, right? So then they take it out on the patient. So I don't think that that's right. I'm trying to think what you could do. You could ask them, why can I not get a second opinion, and have them explain that to you. Yeah, I mean, legally, I guess they can do that. Ethically and morally, no, it's not right. I'm really sorry that happened, though. I hope you went to a different hospital, straight to a different hospital. The other thing you could do, if it's a fairly serious thing and you're not getting treatment and that happens where you ask for a second opinion, they say no, they want to make you sign an AMA and they kick you out, you could call 911 from the hospital, from the hospital that you're at, and say, this hospital is refusing to give me a second opinion. I need to go to a different hospital, and have them come right there. That's something that I know one person that has done that and it worked. Okay, I'm just going to take care of a couple of these people who are just saying kind of gross stuff. Okay, Diane, he left you in tachycardia with heart failure for hours. Oh my goodness. Oh, I'm so sorry. That is not good at all. Okay, Arian, I see your comment in here. So I have decided not to talk about sort of the controversial stuff around COVID on here for lots of reasons. I think it's with any kind of bias. I don't think that healthcare workers, doctors and nurses, sign an oath to do no harm and to be neutral. So, I mean, we all have our personal opinions as doctors and nurses. We all do. But on here, and when I'm working with clients and all that kind of stuff, I want to be neutral with all of those kind of controversial things. So, yeah. Diane, you ended up having to pay the full price of the ambulance. Oh my goodness. Oh, I'm so sorry. I'm so sorry. Okay. Leon, hey, how's it going? I'm good. And I'm just kind of, when people come up on here and they're putting rude stuff, I just kind of hide them quietly, just sort of hide them. Hella, hi. So I'm actually not a doctor. I'm a nurse. I've been a nurse for a long time, 32 years, and I'm a patient advocate now. So I help people navigate the healthcare system. So I'm glad that you're here. I wanted to talk about biases because I've kind of alluded to it a little bit, but there's a lot of them, you guys. Like there's so many. There's so many. There's age. So if you're if you're older, the doctors will say, well, it's just part of aging. What your experience is just part of aging, or you're just older and it really doesn't matter. And then on the other side, there's the people that are young, and there's this like perceived idea or this belief that when you're young, you're automatically healthy. And so if you have an invisible illness, like something that you can't actually see on the outside looking in, hey, oh, that's great. Yeah, listen away. And if you have questions or comments, go ahead. But I'm happy for you to listen too. So if you're young and you have an illness that is invisible, so you can't see it. So like some kind of a chronic illness, an autoimmune thing, chronic pain, or like there's a bunch of them, right? That from the outside looking in, you can't. The doctors think, well, you're too young for that, and they won't investigate it. They'll tell you it's in your head. They'll tell you it's anxiety, or they won't believe you. And they will kind of, there's a lot of ways that people can get dismissed. So ageism. So that is one of the biases that I see a lot of. Another one is weight. So people that are obese, there's a prejudged, like there's a judgment thing that happens, and that's not okay either. They'll say, well, if you lose weight, then your symptoms will get better. Well, no, like that might be partly contributing, but there, to just be judged for that. And it's also people that are underweight as well. I've seen it. Race, different races get treated differently, different genders. Like women are still treated a bit different than men in our healthcare system. Sexual preferences, so like some transgendered populations, or like there's LGBTQ community. There's lots of different communities, or that there are stereotypes against, and it makes me sick to say it that they're out there. I feel embarrassed to be a nurse sometimes because I've seen some of this stuff. But it's out there, and I think it's just not okay. Some other biases that I have seen are socioeconomic biases. So people that are maybe unhoused and living on the streets might get treated different than someone that shows up in a tuxedo. If somebody's not kept up, like they haven't showered for a while, that could just be somebody. It could be me who's just been sick for a whole bunch of days, and I can't get my butt out of bed to shower. I've been throwing up, and my clothes are dirty. But they make these assumptions, right? That you must live on the street if you show up this way, and then we're just not going to treat you the same. So different vocations, like people that have different types of jobs, there's these prejudices against. If you have like a criminal background, maybe you've come from a jail, maybe you've come from mental health. There's a lot of mental health biases and judgments. So there's probably more that I haven't thought of, but these just really burn my butt because like I said, I just don't think there's any room for these kind of biases, and I've seen people get treated different. So what do I tell people to do? What do I suggest? I suggest speaking it right up front. And when you're communicating, and I see some of your comments, and I'm going to come to those in a minute. I'm just on a little bit of a tangent here, so bear with me. I paused the comments so that I don't miss any. But when if you're like in, say, an emergency room, and you're experiencing some of these biases, or maybe you have like chronic pain and you've showed up there a lot, and they're questioning and judging you, you can say straight to them, like, I feel like I understand that you might not agree with my choice of my choice of a job, or not to work, or my choice of housing, or whatever, or you see me as being young, and you might not agree that I have pain or that I have this, but this is a concern for me. this is something I'm experiencing, and I need you to take it seriously, and I need proper care. So, you know, like but you got to be calm, and that's the hard part sometimes. And I get that. And trust me, I have felt like losing my crap on doctors and nurses many, many, many times. When I see a doctor kind of being disrespectful to a patient, that is just really, or degrading or dismissing or condescending, it's really hard to keep your cool. So if that's happening to you, it's easy to just like lose it, right? That just doesn't work. And because there's such a doctor shortage, there's this sense of entitlement that they can pick and choose what kinds of patients they want. If you're too complex, if you ask too many questions, they don't want you. So it's really important to stay calm when you're communicating, and being assertive too, and sharing your heart. Like, it's okay to share your fears and your vulnerabilities. Like, you know, I'm feeling like I'm not being taken seriously. This is a concern for me. Like, it's a real concern. It's affecting my life. And even just saying those few words can make a difference. Okay, that was my tangent on that. So I am going to scroll. Mama S15, thanks for your patience as I talk. So you had cholestasis, twice. You're 22 with 2 toddlers. What's the reason? You had both at the 30. Oh, so both times you were pregnant, you had your gallbladder got inflamed or whatever. You know, so Mama, I'm not a doctor, right? I'm a nurse, so I have to be careful what I say on here. I obviously can't give medical advice. I can't do any of those kind of things. It could be that the pressure of your baby, just your baby being inside, and your gallbladder, it might have just been putting pressure up against it and it got irritated and inflamed. That would be my guess, but I don't really know for sure, and I'm not a doctor, but you could definitely, and I don't know if you've had it since, like any other time besides when you were pregnant, but I've heard of that before for sure. Hi, Paulette. Good to see you on here. Diane, you stayed very calm and polite, but the cruelty was so over the top. The whole staff were unkind, but I kept my voice calm and polite. Good job. I know that that's hard. You have so much fear of authority now, and especially medical people. I don't blame you, Diane. That is valid. Do you know that there are counselors who are specializing, this is kind of more recent, in medical PTSD. So post-traumatic stress disorder that comes specifically from the healthcare system. And so, but anyways, I'm not suggesting that that's something you should do. That popped into my head that being traumatized is a real thing that's happening. And I'm very sorry that happened. And I hope that you can find somebody to trust in the system, because and it can be anybody, and that you have someone that can kind of go with you. Gamanit, did I say that right? Gamanit? Yes, absolutely. I can tell you a little bit about so my name is Paige. I'm a nurse. I've been a nurse for 32 years. I've worked in emergency rooms, trauma ICU. I've flown with air ambulance. I've done some mental health in addictions as well. And I've worked in a few other areas within the hospital and the community, but I'm a patient advocate now, so I help people navigate the healthcare system. So if you've checked out any of my videos, I usually put 2 or 3 on a day. They're short, they're just like shorts, but all different kinds of topics, because there's most countries, and I've had clients in a lot of different countries around the world. And it's interesting because this is a universal problem, except for Sweden. Sweden has an amazing healthcare system. But that's a truly universal system. But this is a global problem, because it's just under-resourced, right? Like, there aren't enough resources. And so people are falling through the cracks. There's so many ways that people fall through the cracks, and I've seen a lot. So I try and just educate and share the things I've seen. Hopefully it might help somebody at some point as they're dealing with things in the healthcare system. Thanks, Gary. That's awesome. Thank you. Thanks for your support. That's great. Sorry, Gamani, that took me a while to get to you, because I go on these tangents, as you've noticed, about things that I'm passionate about. And The other thing too is it's a little confusing because my channel name is Paige Lennox Books and Patient Advocacy. So I'll just quickly explain that. So I'm also an author, and this channel was originally supposed to be just for my books. But then I wrote my healthcare book, and people started asking for videos on healthcare, on patient advocacy, those kind of things. And then it just sort of morphed into this. So, and I didn't want to change the name because I had people already on there. So anyways, that's kind of why and it's a little confusing. I get it. It's not really super clear, but that's kind of the gist of it. And it's great because this is really where my expertise is, and this is something I'm very passionate about. So, Diane, thank you for listening. It happened 4 weeks ago. You're still quite shaken. Oh my goodness. I feel you need therapy to help me understand that. Absolutely. I'm a big believer in counseling. I go for counseling off and on over the years. I've gone for lots of counseling. I think having a third person kind of giving some perspective can help. I would absolutely, like you probably have some PTSD and all of those, but if you're anxious and scared to the point of not going to the hospital until it's an emergency, like a life and death thing, then that's not good, right? So I hope that you can get some support for that. Because that's, yeah, it is, but I get it. I totally get it. Arian, oh, you're I'm not sure why you got flagged. So there are some, yeah, I'm not really sure. There are some, what's it called? There's some parameters on here for sure. There's certain words that are not allowed to be said. So I don't know if that's what it is or what, but sorry about that. Okay. Gallbladder storage says gallbladder. You got to stop eating greens. Oh my goodness. Okay. Hi, Rebecca. Good to see you on here. Okay. I am just going to talk about something with salt and your liver. I'm not sure what you mean by that. Oh, for your gallbladder. Salt and, oh, so you know what might have happened, Mama, is maybe your liver might have gotten enlarged. It could be something like that. And the salt, the way that your body was using salt when you're pregnant, maybe it was altered a little bit. And so I'm not really sure. This, the absorption and that, I don't really know. So if your liver was enlarged, then that would make sense that it would affect your gallbladder. So anyways, yeah, oh my goodness. You had salt in your bile or something and it was getting clogged. Okay, so yeah, so your body wasn't getting rid of, it might have been your liver wasn't, yeah, your body wasn't getting rid of salt the way it normally does, and so it got backed up. Yeah, that makes sense. Sorry that happened. That must have been, especially the second time when you're pregnant, you're probably like, oh my goodness, why is this happening again? Diane, I'm disabled, 71. And okay, you're 71 years old, you're disabled, you walk with 2 canes, and the doctor called a bunch of security guards to escort you out if necessary. Oh my goodness. I'm really sorry. That must have been, no wonder you're traumatized. Yeah, that's not okay. That is not okay at all. Okay. Okay, storage. I'm not sure what you're talking about all there, but we're talking about healthcare system and ways that people can fall through the healthcare system. People are sharing lots of vulnerable stuff on here, so I just want all of us to be respectful of the people who actually want some support and help. Okay. Oh my goodness. Okay, just 1 second, you guys. Sorry. I need to get a moderator. Okay. So there's something else I kind of wanted to talk about that a lot of people get confused about. Hi, Anime Queen. I think I said that right. I'm glad that you're on here. I was just going to send random fun facts for no reason. Oh, that's funny. Oh, okay. So I want to talk a little bit about when to go to the emergency room versus when to go to urgent care versus when to wait and go see your doctor. Because a lot of people get confused about this. Like, who should be, like, when should you go where? one thing that is happening in smaller centers is that urgent care centers and walk-in clinics are getting shut down. So that really only, and then there's a doctor shortage. So that really only leaves like your doctor or the emergency room. And if you don't have a family doctor, you kind of have to go to the emergency room. So I'm not talking about those situations. I'm talking when all three are available and something comes up, how do you decide where to go? So if you think, should I go to the emergency room? Go. Like you should, if you even have that thought, chances are you should probably just go. But an emergency room is for life-threatening things or emergent things. So anything to do, any kind of chest pain, anything to do with your breathing, anything to do with your head, like if you had a concussion or you feel dizzy or, like maybe a stroke is happening, you got numbness and tingling or drooping face or a severe, allergic reactions, like anything that is kind of life-threatening. You have a major cut or a big broken bone, massive like pain that just won't go away, all those kind of things, right? Things that need to be seen now. Urgent care is more things that need to be seen today, but maybe not in the next hour, right? So those are things like maybe a sprain or like a persistent fever. Well, actually, no, a persistent fever, you'd want to go to emergency probably. But, a sore throat, a UTI, an ear infection or earache. Those kind of things that need to be seen urgently today, but not necessarily in the next hour. And then otherwise, things to kind of wait and see your doctor about would be things that are kind of chronic things, like things that have been going on for a while, and you need to follow up, or something comes up that's not really, could wait a day or two to be seen. So those things are really important to kind of be able to discern. And another thing you can do if it's safe, like obviously if it's life and death, call 911, get your butt to emergency. If there's time and you want to, you can call 811. Like you can call that line. It's a triage line as well, and they can guide you maybe onto where the best place for you to go. But if in doubt, go to emergency. Like don't mess around. Okay, I'm just gonna scroll here, make sure I don't miss any of your questions. Anime Queen, the healthcare system is something else when it comes to your health. I know. The healthcare system is broken in most places in the world, in a lot of them anyway. Yeah. The Lurch, I don't know who that is, but said concussions are only mental or in your head. No, concussions, and I'm not a doctor, but I do know that a concussion, it's an actual physiological thing that happens in your brain. Like your brain has been bumped. Often it kind of bumps up against the skull, and there's a lot of serious things that can happen from that. Sometimes, they're very minor, but if you even see stars, like that's technically a concussion. But sorry if somebody told you that your concussion was mental health or in your head. That's not cool. Kat Staffer, thank you for being passionate about patient advocacy. We could all use more of this. Thank you. Thanks for the encouragement. I'm glad it's helpful. Like that's encouraging for me. So I really appreciate you saying that. That's awesome. And if you have any questions, and you guys, I try and come on here at least once a week. Now that I have my voice back, I lost my voice over Christmas. It was so weird. I wasn't sick. I just couldn't talk for a week. It was really quiet around my house. But yeah, if you think of something that's, fairly urgent or another question, I'm fine with you message me or whatever. So yeah, Anime Queen, because not all doctors can be right about how you feel. You can go in with symptoms of feeling weak and dizzy, and the doctor can say you're not drinking enough water. Yeah, absolutely. And second opinion is always best. Second opinion is definitely a good option. The other thing you can do, and I don't know if you were on here a bit earlier when we were talking about bringing someone with you to an appointment. The appointment goes, it's a lot more thorough. So the doctor is more likely to investigate more thoroughly if there's someone there with you. And it can be anybody. It doesn't have to be a medical person. It can just somebody that has your best interest at heart, right? And they can kind of just be present, take notes. They can help you ask questions. So, but yeah, I mean, You can also kind of call it out too, right, Anime Queen? Like if you go in feeling weak and dizzy, and they say, well, just go drink a bunch of water, or it's in your head, you can say, you know, Dr. So-and-so, I understand that you think, you know, this is caused from me not drinking enough water. However, this is a concern for me, and it's been going on for a week. I'm just making this up. A week. It's affecting my life because, you know, I'm not able to work properly, or I'm not able to function properly, or, you know, I don't feel comfortable driving or walking or whatever, how it's affecting your life. And what can we do to investigate it? Like, can we rule some things out? You can try that too, as kind of just really addressing it head on. And then obviously, if they're still not listening, you probably need to get another doctor. Okay. I don't know. I'm just kind of scrolling here. I'm ignoring a few of these. Go to your, so Truth 006, go to your doctor for everything. You were dizzy and turned out you had a tumor. Your brother had indigestion and he had a heart attack. Your aunt had a headache and she went into a coma and had an aneurysm. Oh my goodness, Truth, that is a lot. Yeah, I mean, you know your body, right? Like if something's not right, you know it often before it'll even show up on a medical test. You just know something's not right. And you got to trust that, and you've got to be persistent. And if you're hitting brick walls, the worst thing you can do is lose it on them and storm out the door. Like, it's really hard, but if you need to, if you need to say, I'm feeling dismissed right now, I need to just stop for a second so I can take a breath, Dr. So-and-so, because I'm getting angry or I'm getting frustrated or whatever. And then just keep being persistent. Like, I understand this is what you think. This is concerning for me. And I don't really want to leave without us talking about how we can investigate it. So anyways, I agree with you, Truth. Thank you for sharing that. Because yeah, if you're feeling it, if you just know something's not right, go get it checked. Anime Queen, like your doctor once asked you if you smoked crack or coke. I can't say some of these words on here. Smoke drugs because you were skinny. Mind you, you had anemia. Oh my goodness. Yeah, that's not, if you're underweight, that's one of the biases that we were talking about earlier. It's not just people, when they have, like if they're overweight, they have judgments against them, and their weight is blamed on like their symptoms, or sorry, their symptoms are blamed on maybe their weight. But it's when you're underweight too. I've seen it a lot. So that's frustrating, and I'm sorry you experienced that. Yeah, that's not okay. Hi, Amy. Cat Staffer. Anxiety in anticipation of being dismissed is so common. I've let it stop me before I've let it stop me more than once before, forcing yourself to make the appointments. Absolutely. So there's another lady on here, Diane, who is sharing an experience that she had, and now she's so scared to go to the doctor that she waits, and it's almost that she has to wait until it's an emergency before she'll go, because of that fear. The way she's been treated has been so poor. So yeah, it is a common thing, and gosh, it's just like, it is hard. It's so hard. I wish there was a simple answer. It's just really hard. And I'm sure you have let it stop you before. Because why do you want to voluntarily go somewhere where you know you're going to be dismissed? But, hopefully you can find some good medical providers. Like nurse practitioners are a really good option too. There we go. I just don't want to lose my voice again. Okay, Anime Queen, when you had low iron anemia, you felt weak, and they kept saying, we'll run a test. They came back and you needed iron infusions for 5 weeks. Oh my goodness. Oh my goodness. So there was actually something going on. Wow. Well, I'm really, that's awesome that you advocated for yourself so well. It's awesome that you were persistent. I'm glad that you got that treated, for sure. Okay, EB, I'm regarding you. Okay, what have you for medical advice if you go to one doctor and she says that she cannot give appointments? Then you see a second doctor and they see you without an issue. The healthcare confused me. Yeah, it is confusing, EB. I don't really have a straight answer for that. Every doctor, like I wish there's some awesome doctors out there. Unfortunately, they're not all equal, and so that sounds like the first one was just. I don't know. I can't answer why they wouldn't take you on. Sometimes doctors, they get lazy. They don't want to, or if there's something complex, they might not want that, or I don't really know. But I'm really glad that you got a second doctor and they see you. And I would try and keep them. Hold on to that good one. And it wasn't you. I'm almost 100% sure that it wasn't you. It wasn't a personal thing against you. It's just, who knows? Could be their ego. They could have been in a bad mood that day. I don't really know. Maybe it felt too complex. Like, it's just really hard to say. But I'm glad that you were persistent, and I'm glad that you went and found a second doctor, because you deserve to have a doctor that listens, who respects you, it's a partnership, like a doctor-patient relationship. It shouldn't be a power dynamic. It should be a relationship where the doctor actually asks you, what do you think? Like, how do you feel? What if we do this? Like, they listen and they take it in. So, hi, Lori Fullerton. Good to see you. Okay, what is it? Christian, hi, good to see you. Yeah, so my name is Paige. So I'm a nurse, and I've been a nurse for 32 years, and I've worked in critical care mostly, emergency rooms, trauma ICU. Sorry for those of you that have been on here a while. I sound like a broken record, but when people are just coming on, they're like, what the heck are you talking about? So I've been in the system for a long time. I flew with air ambulance. Now I'm a patient advocate, so I help people navigate the healthcare system. So all of the ways that people can fall through the cracks in the healthcare system, that's what my videos are about on my channel. They're short. Most of them are just shorts. And that's what these lives are, is just talking about a lot of the stuff that I've seen, unfortunately, and sort of pulling the veil back on that, not exposing it in a negative way, because I'm not here to trash doctors. I'm not here to trash the system. But our system is broken, and patients deserve to not fall through the cracks and to get good health care. So it's more about just sort of raising awareness, educating. I love questions. A lot of people will come on these streams and share different experiences in the healthcare system, either with themselves or with someone that they know. And it's kind of cool, because sometimes there will be someone else that has had a very similar experience, and they'll be like, oh, wow, I've had that same thing. And then they end up sharing resources and like kind of offering suggestions, support, whatever. So it's kind of cool. Anime Queen, yeah, maybe that doctor it was booked solid for that day. It could very well be. So I hope that answered your question, Christian. And if you guys know anybody hi, Brian. If you know anybody that would benefit from this, like anyone that you know who is struggling with anything in the healthcare system, it can be there's so many ways people can fall through the cracks. Like we talked about, all of the biases that happen, the judgments, doctors not listening to the patients, dismissing them, not believing them, minimizing, saying it's all in your head. And the hospitals doing that too, long wait times. People not getting a proper diagnosis, people not getting the proper treatment. Oh, I could go on and on and on. Like, there's so many different ways that people can fall through the cracks. Catch vitiligo. I have no idea. I have no idea what that is. Catch. Anime Queen, because once you tried to get a doctor's appointment and you couldn't get one, turns out they were booked for the whole month with other patients. Yeah, it absolutely could have been something like that. Christian, yeah, you're very welcome. I hope it's helpful. Yeah, I hope it's helpful. That's definitely my heart, is to just kind of raise awareness. I have a TikTok channel as well, and I do lives on there too, but I'm kind of focusing more on YouTube for some reason. It's just I'm really enjoying there's a lot of really great dialogue and lots of it's just really good. So okay, truth. Doctors are no longer about patient care, but rather about how much money they can earn. We were saying that earlier. Thank you, Brian. we were saying that earlier, that it's a business. Like healthcare has become a business, and doctors and nurses, we sign an oath to do no harm, right? And to also be neutral and unbiased. And unfortunately, and I mean, every hospital, it's a business. There's a hierarchy, there's administration, there's, it's all about cost and cutbacks, and there's such a doctor shortage right now too. There's fewer doctors graduating from medical school now than ever before. So that is kind of and that just filters into the whole rest of the system, the community care, rural centers, like remote centers, hospitals, obviously. So yeah, it's kind of crazy. Anime Queen, that's how I felt. A bunch of tests were ran, even though you had back problems. They were like, oh, you're fine. Oh my goodness. So you were born with back problems, and with one leg longer than the other, but they kept telling you that it was in your head, your back pain. Oh my goodness. I'm really sorry that happened. And you guys, if your messages get like blocked or anything, I don't know. There's some filters on here, things, because I talk about healthcare. There's things they don't want me talking about, I guess. So they put filters on. So you might want to find a different way to word it or whatever. Christian. So I'm actually in Canada. I'm in Canada. I have clients all over the United States, in Canada, in Australia, in Europe, India, China, Iran. Did I get them all? I think that's all my current, the clients right now. So anyways, so yeah, and it's interesting. The healthcare systems in different countries are very similar. The biggest difference is the billing, like the way that money is exchanged. But otherwise, I mean, our physiology is the same. So yeah. Ben's dad, good to see you on here. So yeah, I don't know if you guys have any other questions. I'll show you my book really quick. This is Canadian. So I am an author as well, but this isn't up to pitch my book, but some people were asking about it, so I'll just show you. It's Unlocking Canadian Healthcare. I'm thinking about writing one for the States about how to navigate the American healthcare system. This one is Canadian, but it's a guidebook. So it's not like a book you read start to finish. It's got all these different chapters. It's all color-coded because I'm like super nerdy. It's got lots of resources in it, but it's got things like knowing your patient rights, mental health and addictions, LGBTQ, navigate, just general, like how to read your test results, referrals, how to follow up, seniors, end of life, caregiving, like there's all these different chapters. So, and then each chapter sort of has a bunch of resources. Anyways, so yeah, I don't know. I'm thinking about writing one for the States because I've had quite a few requests to do that. I'm just kind of thinking about it because I know a lot about the American system as well. But anyways, it's on Amazon. If you want to check it out, go for it. Anime. A test came back saying it was normal and there's nothing wrong with your back. Oh my goodness, you actually were born with something wrong with your back and they were telling you that something was not wrong with your back. Oh boy, and they came back normal. Yeah, and yet you were still having pain. That's tough when that happens. And I would ask to have a retest maybe, or a different kind of test. So maybe they did an x-ray and it showed up normal. Maybe they need to do a CT scan or an MRI of your spine to have a look. But I'm not a doctor, so I have to be careful. Gary, the good physician treats the disease. The great physician treats the patient who has the disease. Yes and amen. 100%. That's, I think, one of the reasons. Thanks for sharing that. I love that. I need to write that down, I think. Because that's just so accurate. And that's why I love nurse practitioners. Because they can do almost everything that a doctor can do. Did you know they get paid like half of what a doctor gets paid, and yet they can do almost everything that a doctor can do, and like a medical doctor? Anyways, that's a side note, but yeah, that is so true. They treat the patient who has a disease, so they treat the whole picture. And we are not just skin and bones, right? Like we have a brain, we have a heart, we have a soul, we're like this whole unit, and so that's what needs to be treated. And that includes being respectful, listening, working as, being responsive to the questions that the patient has. Love that, Gary. Thank you. Yeah, like Truth said, that a backache is very hard to diagnose and prove. It is. Yeah, it is very hard to diagnose and prove. Unless there's something. A lot of doctors, they're kind of hesitant to order spinal MRIs, and they are costly. I get that, but it is hard, and it's hard. Like, backs are funny because you've got all those vertebrae, right, and all those discs in between. And then there's all the nerves that run down your spine. So you don't want to just jump into something like physiotherapy, chiropractor, massage, if there's something structurally wrong with your vertebrae that it could make it worse, right? So it's tough. Like, you want to make sure that things are structurally okay. You don't have a small fracture, or your disc isn't being compressed or something like that. Yeah, backs are definitely tricky. Tangena, sorry, I said that wrong. You're from Bangladesh and you're sick. I'm really sorry to hear that. Cece, could you share your idea of nursing as a career? I absolutely can. So I've been a nurse for 32 years. Up until the pandemic, if someone asked me, is nursing a good profession? I would say 1,000% yes. It is amazing because there's so many options. You can go travel nursing. You can work on the phone. You can work all these different departments in a hospital, a community, a doctor's office, like public health, doing vaccinations with babies. Like, there's education. There's so many options, and I still think it's a great profession. The pandemic changed things a little bit. Like, nurses now they're overworked. Like, the nurse-patient ratio is really not super safe in a lot of hospitals. But yeah, I still think it's a great career. I think there's still a lot, and there's more and more options all the time. There's more private things popping up, and telehealth, and all kinds of stuff like that. So I think it's a great career still. Just, I'm not quite as enthusiastic as I used to be. Tangina, multinodular goiter tumors. I'm so sorry in your thyroid. I'm really sorry to hear that. So Anime, they did do CT scans and they came back normal, but you still have pain. Interesting. So there's something else going on, a nerve. I'm not a doctor though, so I don't know if you've seen a neurologist maybe to check out your nerves. Christian, what do you think about recent vaccines? I hear too many mixed thoughts about them. Okay, someone asked me something about pandemic stuff earlier. So I have my own personal opinions for sure about them. I need to stay neutral on this channel. A lot of doctors and nurses are trying to stay fairly neutral. Yeah, so there are mixed thoughts though. I don't think there's one straight up answer. I have my own personal opinion that I need to be careful about sharing on a channel like this, because I want to be neutral, right? Like, I want to support, and that whole thing was so divisive. Is that the right word? Divisive? That it just pulled people apart so much that I want to be sensitive to that. So, Truth, you have scoliosis on your L5 vertebrae, slightly C-shaped. The doctor told you it was not the cause of your lower back pain. I'm doing an eye roll here if you can't see that. Oh my goodness. They told you it's not the cause. So if you guys don't know, your lumbar spine is your lower back. So, oh my goodness. I can see why you're laughing, because that made me roll my eyes. I hope it wasn't too obvious and rude, but that is crazy. And sorry to hear that. Back pain is awful. It is debilitating. And scoliosis is hard because yeah, that's tough. Anime, maybe it's nerve damage. It could be. It wouldn't be a bad idea, Anime, especially if you have like shooting pain down your legs or any kind of like numbness, tingling that goes along, or if it moves anywhere, if your back pain moves anywhere, to ask for a referral to a neurologist, and they can do a nerve study. And test all your nerves and make sure it's not something like that. Okay, you guys, I've got about a minute left and then I'm going to hop off. I will keep doing my lives for sure because I love them. I think it's, and I want to be available too. It's great having my shorts, the videos, but yeah, I don't know. I think this is it's hard. You guys can ask questions on those. Well, you can, I guess, in the comments, but oh, just one more. So Truth said, Anime, your one leg is shorter than the other. That's possibly why your back hurts, because your body is badly aligned, causing pain. For sure. Yeah, totally, for sure. Christian, no, I just joined. I know, I've been on here for about an hour. I'll stay on for just a little bit longer, long when my voice holds up. But that's a good point, Truth. And I don't know, I thought she said that she had been, that your different leg length, because she was born with that. So I thought that had been resolved, but maybe not. Maybe it's still a thing. And if that's the case, then if your legs are two different lengths, it's going to put your hips out, definitely affect your back, eventually your knees, maybe your feet. Yeah, that's a really good point. Just let me have a sip of my tea. Something I was going to talk about too is preparing. And I don't know if you've seen my videos. I've done quite a few on preparing for doctor's appointments. And the reason I'm so passionate about that too is it can make a huge difference. Like, you have to wait a long time to get in to see your doctor often, especially a specialist. Like, the wait times, at least in Canada, they are months to years sometimes. In the States, it's still very long for sure. I think not quite as long maybe for most of the ones that I've sort of referred people to. But so making sure you're prepared when you go. And that looks like a few different things. Like, it looks like sitting down before and actually writing a list of your priorities, the things you want to have answered, and pick your top 3. So I don't know, every doctor is different. Sometimes like 5 minutes you've got, sometimes maybe 15 would be like a max. So going prepared, having your top number 1 thing that you want discussed at the very top. And you can even go in and you can just like heal, or you can just sort of hand them the piece of paper, hand the doctor that, and Truth, oh, take all your healing to Jesus, and by his stripes you were healed. Yeah, I love that. Anime, I'm not a doctor, but I think that's a possible thing to think of, because many doctors couldn't figure out why. Oh, so yeah, if your legs, if they are still out of alignment, Anime, and I don't know if a chiropractor might help with that. I'm not really too sure, but I would definitely look into that. I maybe misunderstood that. I thought that you had that fixed when you were a baby, but anyway, preparing for your doctor's appointments. So if you are on blood pressure medications, or need to check your blood pressure or weight or anything like that, have them written down so you can hand them to the doctor. You don't even have to think about it. You just give it to them. Bring your medications. You want to make sure that you know why you're taking the medications you are. Bring someone with you, bring a pad of paper, like, just go prepared. And when you show up like that, they know to take you seriously, especially if you bring out a pad of paper. There's something weird that happens when you bring out a pad of paper and a pen. And I spoke about this a bit earlier. It is weird. Like, and a man on my last live told me that he tried that, and anyways, and it totally helped. But it's like, you're showing up, you're serious about your care, you're involved, and you're ready to go. So go prepared. Super, super important. Christian, oh yeah, osteopath are better than chiropractors. I agree. Chiropractors, I know a lot of people that use them. They make me nervous. I had one once. Yeah, they just make me nervous. It's a bit too aggressive for my comfort level, but I know a lot of people that swear by them. If you, though, you were born with something wrong with your back, I would be very hesitant to go to a chiropractor right away, probably. So that's a good thing. I don't know if they would even be able to help with that, but the more I think about that, exercises, yeah, stretching for sure. Those are good thoughts. You're not a doctor either, but it helps your back. Yeah, so for me and my back stuff, stretches and strengthening exercises that really strengthen, like For me, it's like my lower back kind of on one side, but doing exercises that strengthen my core, exercises that strengthen my butt muscles, like my glutes, and kind of all the muscles sort of supporting the hips. That really helps me. And stretches. The stretches hurt, but they're so good. Anime, you like to jot everything down on your phone to remember what was said the day of the appointment. So if you need a second opinion, you can pull up the previous. That's great. Yeah, that's great to write it down. You can even record them if you want to make sure you don't miss anything. Truth, I see an osteopath there, very good. Yeah, so osteopaths are very good. They also work on the fascia, so it's not just like bone manipulation. It's not just sort of muscle massage, but they work on that fascia layer, which a lot of other providers don't. Oh, about the glutes. Yeah, like that, your glutes, and I think and your hamstrings too I don't do as many for my hamstrings because I don't find them as helpful. But things that stretch and strengthen my glute muscles, my back pain is gone. And I know that as soon as I start doing it, or if I stop doing it, then it comes right back. So I know that's very, yeah. I don't work them out often since I'm a guy. That's funny. That's hilarious. Yeah, it does help. And there's really subtle exercises you can do, and you can just do them at home. All you need is like one of those stretchy exercise bands. That's all I use. Or sometimes at the gym I'll do a bit more, but yeah. All right. Okay, guys, I'm going to hop off. I don't want to lose my voice again. It was, like I said earlier, for some weird reason at Christmas, my voice just disappeared, and I wasn't sick, didn't have a sore throat, I just couldn't talk. So it was very strange. Anyways, I can feel it starting to kind of go again. So I'm gonna get off. I'll come back on another time for sure. And Roman, sharp pinpoint pain, upper right side of your sternum, a sign of a heart issue. I don't know, I'm not a doctor, but I would get it checked. I would go right away and get it checked. Like, I wouldn't mess around. If it's kind of in your chest area and it's a discomfort, go get it checked at the hospital. Like, go to the emergency room right away would be my suggestion. Okay, you guys, well, thank you so much for participating and hopping on here and joining me. Tonight, I just kind of hopped on randomly, like just, I didn't like schedule it ahead of time. If I was a bit more organized, I would probably schedule it so that so people could see. What I might start doing is putting in the comments, and I haven't done a lot of that, but put in the comments when I'm going to be going live. So I will try and do that ahead of time, but I forget sometimes. So anyways, love you guys. Thank you. Thanks for your support. And yeah, if you think of any other questions, go ahead and message me. I'm also on TikTok if that's easier to message on, but I love YouTube. I think it's, I just like this culture a little bit better. But anyways, thank you guys. Have a great night. See you next time.